The Jackass crew got paid millions of dollars to destroy their bodies on camera. The injuries are real, the surgeries are real, the long-term consequences are things they will carry for the rest of their lives. 16 concussions, an orbital bone that turned into powder, brain hemorrhage, torn urethra that required a catheter for 3.5 years, and $8.6 million medical bill.
The busted board, one wheel squeals, one bolt's lost. She said, watch this.
His brain was bleeding, third-degree burns across 15% of his body, 3 broken necks, and I'm going to break down every single one of them. I'm Dr. Sam, the Reconstructor. Let us see what these guys did to themselves.
Like, I think I could have legit died.
Johnny Knoxville has been, in his own words, almost dead 5 or 6 times. Let us start with the one everybody remembers, Butterbean. That knockout is what a concussion looks like from the outside. But here's what's happening inside the skull. The skull is a fixed plate with the brain sitting inside, bathed in a little bit of fluid. The trauma externally causes not only can break the bone on the outside or the skull, but the softer tissue and where the damage can really happen is on the inside. That brain gets jostled against the wall of the skull and can have a coup and contra coup effect, where it hits one side and then on the opposite side it can have an effect as well. So concussion is swelling and damage from that trauma to the brain. It can leave someone knocked out on the floor. They can have memory problems, difficulty speaking, difficulty sleeping, headaches, seizures. The damage that can come from this is critical because the brain is a vital organ of our body. One concussion is bad. Knoxville has had 16. That's not just the number, that's cumulative and permanent brain damage. But the concussions are not even the worst of it. During Jackass Forever, a bull hit Knoxville so hard, he had hemorrhage within his skull. That's bleeding. His wrist was broken, his ribs were broken, and his orbital bone did not just break, but in his own words, it powdered or turned to dust. And when he blew his nose afterwards, his eye popped out of the socket. Now, what happens when someone suffers from a hemorrhage or intracranial bleed? So in these scenarios, usually that blood needs to be evacuated. So an incision is made, the skin is peeled back, the skull is removed, and the blood is evacuated. So they remove it, wash it all out, and if there is active bleeding, that bleeding needs to be stopped. So that is one consequence from a hemorrhage. Now let's talk about the next injury, an orbital fracture or blowout fracture in his case. That's when the orbital bones or the bones around our eye socket. Blowout is where the bottom or the floor of the orbit sits. It's critical because that's where the eyeball sits. When there's a blowout, that basically means there's no more floor left, it's blown out. And the consequence is muscles can get trapped in there, the eyeball itself can get depressed, it causes asymmetry, you can't see correctly, and in really dramatic cases, if there's entrapment of the muscles of the eye or the eye itself, those muscles can die and can have permanent damage to one's vision and sight. So, in those cases of entrapment, it is a surgical emergency. So after imaging is done first, that's how we know what is exactly broken, and it's identified, then we go to the operating room. The cut is made underneath the eye, either through the lower eyelid on the outside, or often can be made on the inside of the eyelid. That eyelid portion is opened up, and we free up all the way down to the bone. So we start on this bone on the outside, the zygoma, and then we free up and extend into the orbital floor and dissect, lift the eyeball and the socket itself up and out of the way, identify where the fracture is. If the fracture pieces are there that we could pull them together, we will use them. If it's really blown into bits, we cannot. But the treatment is still gonna be the same, plates and screws. And one of the plates we use for the orbital floor has a mesh to it, and it's like a webbing like this, with on the front several spots for screws that get screwed into this bone to hold the bone in place as well. So this plated mesh gets placed underneath, recreates a new floor, and is put in place with multiple screws along the zygoma itself. That fixation holds it in place. We're very careful that the eye gets lifted and put back down safely, so there's no entrapment, and this can be tested to make sure the eye moves okay. And now we've reconstructed the orbital floor. Now, Johnny Knoxville also claimed that he came to blow his nose and his eyeball popped out. Well, this is Johnny Knoxville, so Lord knows what is really true or not. But let's explore the mechanics behind something like that. When there is an orbital floor blowout, it's connecting with the sinus space above. So when someone does create pressure to blow their nose, that air could rush up theoretically and push his eyeball out. More likely what would happen is the eye itself would get sunken in to the floor fracture, and it would take a significant amount of force to really be able to blow the eyeball out. But in the realm of possibility, I guess it is possible, although extremely unlikely. What other injuries did he suffer? He had a broken wrist. Wrists, the same thing like most bones in the body, can be fixed with plates and screws. So over where the injury is, it has to be opened up. He goes to sleep, obviously opened up. The fracture gets identified, a place and screws are placed to hold it in place. The plate fixates that fracture and makes it functional again. Next, ribs. Broken ribs, on the other hand, are more complicated. Complicated because they're not a great way to fix them. But most of the time, with rib fractures that are just in one place and not affecting the mechanics of breathing, Johnny just has to suck it up, buttercup, until those ribs heal. During a stunt, a motorcycle landed on Knoxville and tore his urethra. He needed a catheter in place for 3.5 years, in addition to some surgical intervention. Now, catheters by themselves are already uncomfortable for anyone who's ever been in a hospital needing to have a catheter placed as part of a long surgery and the recovery process. I'm sure they will attest that having a catheter in is not fun. It makes someone feel like they always have to go to the bathroom because it's constantly stimulating their urethra. You have to walk around with a bag attached to yourself. It can often get tugged on and then pulls on stuff that you don't want to have pulled on. So in general, not a fun experience. Steve-O has broken over 20 bones, had collarbone surgery, and sustained third-degree burns across 15% of his body. 20 broken bones is a lot, but the burns are the real story here. Steve-O covered his back in rocket fuel and lit it on fire. The pain was excruciating, and the severe third-degree burns meant he needed skin grafts to cover the 15% of his body. What happens when someone sustains severe burns? The treatment is similar depending on wherever it may be, whether it's an arm or a leg or a back in his scenario. But we start out with debridements, or cleaning the area to make sure there's no dead tissue left behind. Dead tissue or burned tissue is perfect for bacteria. Bacteria love it and they live off of it, but that infection can become life-threatening in someone whose entire back is burned. So it requires ICU care, lots of fluids to make sure they're not losing and get super dehydrated because the skin is gone. What is the reconstructive technique? Skin is gone, we need to recreate skin for him. And there are several options on how to do this. The first and most common is a split thickness skin graft. That's where we take a device called a dermatome that looks like a giant cheese grater and borrow skin from a certain part of the body. Usually we use the outer thighs, and we take the dermatome, take a piece of the skin off, and then place it wherever it needs to go. Even with modern techniques where we apply certain dressings to help control some of that burning and pain, is still not a fun process. He sustained these injuries during years of documented drug abuse. His body was already compromised. Fortunately, he lived through all this and ended up coming out on the other side a sober person, probably healthier than he's ever been in his life. Ehren McGhehey has broken his neck 3 times. 9 knee surgeries, $7.3 million. 3 broken necks. How is a person even alive after that? Maybe Danger Ehren should be actually called Lucky Ehren for the fact that he survived 3 separate spine fractures. Now, the fact that he survived is amazing, but again, a lot of that goes into where the fractures are. So the common mnemonic is C345 keeps you alive. And that's important because the cervical bones, or the cervical spinous processes at level 3, 4, and 5, are important because of where they house the spinal cord. At that level of the spinal cord, if an injury happens and there's a fracture and damage to the cord itself, which is the entire nerves of our body, you lose the ability to be able to breathe on your own, and then need to be on a ventilator for the rest of your life. So, fortunately, that did not happen to him, and his injury was lower down. He's even more lucky in the fact that he doesn't have any permanent sequelae, which means his spinal cord itself was probably undamaged, even though the bone around it, or the spinous bones, were fractured. So, lucky on top of lucky, I think he should rename his name as Lucky Ehren. 9 knee surgeries, ACL, meniscus, cartilage. When is a knee too damaged to be rebuilt? And at some point, damage becomes too much, and that's when patients end up with total knee arthroplasties. The dumbest thing he's ever done is, without question, the Lamborghini tooth pull. One end of the line was tied to a Lamborghini bumper, and the other end to a completely healthy upper tooth. The resulting stunt didn't just remove the tooth, it fractured the entire bone all the way up to his socket. Why did this happen? Normal bone is anchored, normal teeth are anchored within bone. If you pull that tooth out with abnormal force and trauma, it's gonna tear the bone associated with that. And this bone is all one solid piece of bone extending across his maxilla up into the socket of the eye. So, if this gets ripped out hard enough and with significant enough trauma, which a Lamborghini has created, obviously, it can result in a fracture extending all the way up. Now, this needs to be obviously repaired. How does that happen? He's gonna end up in the operating room asleep. Depending on where it is, 1 plate may be enough with screws, sometimes 2, and sometimes, because it involves the jaw itself, right? This is the upper part of the jaw. He may have even had to have his mouth wired shut to help maintain alignment. Sometimes we do it temporarily to put the plates and screws in. Sometimes we do it in conjunction with plates and screws and leave it that way, just to make sure everything can heal appropriately. The consequence of being wired shut means he gets to lose weight and drink everything through a straw. Now, as part of his injury, this fracture was bad enough that he'd actually lost pieces of bone. So what do we do in that scenario? He needed a bone graft. 3 guys, decades of self-inflicted damage. Let's rank them. Now, a couple different ways we can approach the ranking. One, in terms of what's the most painful, or we can look at what's the most recoverable. I think our most recoverable and least painful is always going to be Steve-O. So, looking at the picture of all the damage he had, now it's arguable that he may have had the most pain as part of the burn on his back, but reconstruction is fairly straightforward. We've been doing it for years and years, and he will regain normal quality of life and function. Now, we're stuck looking between Ehren and Knoxville. Ehren with a split in his face from ripping out of a tooth, all the surgeries he's had, but I will say that I think his is less bad compared to Knoxville, because 3.5 years of a catheter and splitting urethra wins in my book. Steve-O, most recoverable, probably super painful, but he made it out alive. Ehren, dumbest thing I've ever seen, but even that can be fixed with some plates and screws and bone grafting. Knoxville, maybe it's time to retire, my friend. A urethral break was not enough. Let's see what comes next. I'm Dr. Sam, the Reconstructor. Do not try any of this at home. Actually, do not try any of this anywhere.